the session, the AbbVie session where we talked about the change in the CLL therapy. So we've moved now, obviously, to the era of very effective B-cell receptor inhibitors, but patients are now beginning to fail those or be intolerant to those. And Venetoclax, which targets BCL2 and leads to very dramatic responses, is really giving us another option, both now in clinical practice as well as in the clinical trials that we're doing. So we overviewed the science behind why BCL2 and apoptosis, resistance to apoptosis, is important in CLL. It's one of the two key pathways. Why CLL may be more sensitive to inhibitors of BCL2 than maybe other diseases, because they're sort of prime for apoptosis, the cells, and also the very dramatic responses we're seeing with Venetoclax, the specific BCL2 inhibitor, and also the challenges it creates. So, we're seeing tumor lysis, which, as a haematologist, seeing tumor lysis and profound remissions is obviously very encouraging, but the tumor lysis can be very rapid and very profound, so and life-threatening. So it's very important that we educate people, as this drug is now available, in the appropriate introduction of the therapy to patients in the management of certainly the first few weeks of the treatment. With the tumor lysis with Venetoclax, it's manageable. So we have to treat it with respect, because although we've got predictors that will identify patients who are likely to be at higher risk, those with bulky disease with high counts, or those with some degree of renal dysfunction. So if they've got biochemical abnormalities, they're the patients I particularly worry about. There are patients who will get tumor lysis who we can't predict. So we always have to be very aware and not get complacent about starting the treatment. Having said that, with the appropriate management, with the appropriate sort of observation, we should be able to get the drug into every patient. The tumor lysis rate's down below 5% in the series so far, and when patients get tumor lysis, as long as we recognise it earlier, we can manage it. The main message is that Venetoclax BCL2 inhibition gives us another important modality of treatment for patients with CLL. We're seeing really good responses in a proportion of patients, and unique almost in the targeted treatment for CLL, we're seeing eradication of detectable disease. So some of the patients who are really sensitive are having MRD negative, minimal residual disease negative remissions, and those patients seem to have a very good outcome. So I think it's an important treatment for patients. It's identifying which patients should be treated with Venetoclax and at what stage, and making sure we safely get it into patients and get the best possible remission.